So this screencast is all about terminology for cardiovascular disease to make sure that we're clear on what we are talking about. And quite a logical name, cardiovascular. Cardio is heart, vascular is blood vessels. So we're talking about diseases of blood vessels. And the names relate to the place that those blood vessels are supplying. So coronary heart disease is coronary arteries are supplying the heart muscle. Cerebrovascular disease is supplying the brain, so cerebro is brain. Peripheral artery disease, the peripheral arteries are those supplying the limbs. So just a clear definition really of where the disease is. You can get rheumatic disease, which damages the muscles and heart valves, and that's due to rheumatic fever, which thankfully is very rare these days. And congenital heart disease, birth defects such as holes in the heart, poorly formed valves, malformations of heart structure. And this website I've given you a link for here is Cardiac Risk in the Young. So some heart diseases, genetic congenital things, are diagnosed early on in life if they are quite severe. But what often happens is that these things are not diagnosed and that we have people as young adults having massive heart attacks and dying because of that. And we lose a lot of young people, young adults, through undiagnosed congenital heart disease. So that's really an important thing to be aware of. Deep vein thrombosis and pulmonary embolisms are related to blood clots. So deep vein thrombosis are blood clots starting in the legs. So that's why people have to wear support stockings after surgery and sometimes when flying to decrease that risk. So those are things that can happen. You can get a DVT after those particular events. So they start in the leg veins, but what happens is a bit of the blood clot dislodges and it can move to the heart and lungs, and then it can cause a pulmonary embolism, which is when a blood clot blocks a blood vessel and can cause breathlessness, but it also can cause damage to that part of the lungs. So that needs urgent treatment, although sometimes people don't realise that's what's going on, so they can be diagnosed quite late and can kill. So looking at cardiovascular disease, some more terms here. You'll be aware of angina, I'm sure, and it's pain due to the heart damage. So that can be chest pain, but also the pain can be in other places. So pain down the jaw and neck is not uncommon, sometimes back pain or even stomach pain, which is due to heart damage. Depends which part of the heart is damaged. And then of course we have a heart attack, otherwise known as a myocardial infarction. And most of those are caused by coronary heart disease, so that damage to the coronary arteries. And what we're talking about is a blood clot blocking the coronary artery so that the heart muscle is then starved of blood and oxygen, and that can actually kill that bit of heart muscle that isn't getting that blood and oxygen. But myocardial infarctions can happen and people not realise they've happened. Sometimes they are, people do obviously get severe pain and they have a heart attack and are admitted to hospital and treated, but they can happen without people realising. A cardiac arrest, however, is when the heart stops working. So it's really important to know the difference between those two things. So heart attacks don't always kill, may not even realise you've had one. Cardiac arrest, your heart stops working, clearly another medical emergency. But heart failure happens as people have progressively had heart damage due to heart attacks. So they're less and less heart muscle functioning properly. And we'll come back to that in a moment. And then we have strokes called cerebrovascular accidents, so cerebro in the brain. So we're looking at poor blood flow to the brain leading to cell death. And again, if that's going to happen, that can cause damage to the brain. Sometimes it's ischemic, lack of blood flow, these blood vessels getting blocked with atherosclerosis, that kind of thing. And sometimes they are hemorrhagic, so the blood vessel bursts and there is a bleed. And that can be fatal. Sometimes it's not, and sometimes people need brain surgery to try and deal with that. But it can be fatal and can be just one of those really quick deaths through severe hemorrhagic CVA. Just put this structure of the heart in for you to just have a kind of quick look and remind yourself of which blood vessels we're talking about when we're talking about coronary heart disease. So have a look at that. Maybe stop the screencast and have a look at that for a moment. But just kind of give you some understanding of what we think about with heart failure. So if someone says to you they've got heart failure, what does that mean? And it is, this American classification I think is quite useful. So class 1, no limitation of physical activity. So someone might have had a heart attack, but the damage to the heart is relatively small, and therefore they're able to continue with normal physical activity, which doesn't tire them or make them breathless or give them palpitations. Class 2 is people who are comfortable at rest, but when they start walking, getting up, moving around, they may be fatigued or get the palpitations or breathlessness or angina. So that would be mild heart failure. Class 3 is more severe, so people might be comfortable at rest, but less than ordinary activity will lead to symptoms. So that might be just getting up to go to the bathroom or something, and they will have symptoms. So perfectly fine at rest, but symptomatic with palpitations, breathlessness, if they try and do any kind of ordinary day-to-day activities, pottering around the house, for example. But class 4 is inability to carry out any physical activity at all without discomfort, and symptoms will be present at rest. Any physical activity is going to cause pain and problems, and those people in class 4, the reason I've put this on here for you is that you may well deal with these in hospital, because nutritional support is what's usually required by this point, because the symptoms are causing difficulty eating because you're so breathless, feeling tired all the time, and often people will have very swollen ankles and legs, and they will need to have that managed in order to be able to survive. So heart attacks, we tend to think people have a heart attack, they die, and that's just not the reality for many, many people. They have a progressively developing condition, making them more and more disabled. So why is it so important? Why is cardiovascular so important? And when we look at it from the perspective of how many people are affected, hopefully you can see how important it is. So non-communicable diseases are causing around about 74% of deaths globally. So we're talking about, a massive impact. And this has changed. It's a rising problem. So we're looking at millions and millions of people who are affected by cardiovascular disease. And ischemic heart disease is right at the top of the causes of death. So that's ischemia, so that's not hemorrhagic. It's that lack of oxygen getting through to the heart muscle. And stroke causing 11% of deaths, but of course stroke causes a huge amount of disability and is the biggest cause of disability in the UK for sure. It's not just a problem of high-income countries as it used to be, it's actually a major cause of death in low-income countries as well. but the causes of death vary from country to country. Excuse me. The Global Hearts Initiative is something that the World Health Organization set up to try and support governments to prevent and control cardiovascular disease. So that's just an interesting read if you're thinking about it more globally. And you can also go and look at the position of different countries for different diseases. So as far as heart disease, we're on 168 in the UK, but different diseases affect different countries differently, and it's just quite an interesting thing to have a look at. So the idea is that we try and manage cardiovascular disease as much as possible. Death rates in the UK have been going down, but the curve has been levelling out in recent years. So we're now talking at about 300 deaths per 100,000, whereas it was 1,000 deaths per 100,000. But we've got more and more people living longer, but living longer with the disability related to cardiovascular disease. And the differences in where people live and difference in social class aspects is huge. So if you live in Glasgow, which even within Glasgow there are huge differences, but it could be as high as 134 people per 100,000 with premature death. In Mid Sussex it's less than 40. So it varies tremendously on where you live. In the UK, we've got about 1 in 4 deaths due to heart and circulatory diseases, and we've got nearly 8 million people living with cardiovascular disease. Coronary heart disease is the biggest killer worldwide. Cancer is responsible for about 28% of deaths, but about 34,000 people each year are dying due to strokes. So we're talking about massive impact on the NHS. We're talking about hospital admissions with heart attacks, but bear in mind how many people have survived a heart attack. 1.4 million have survived, clearly a lot haven't. And we've now got more than 1 million people in the UK living with heart failure. So this is because we are treating heart attacks better. So this figure has actually gone up in this most latest stats. It was about 900,000, and it's now 1 million living with heart failure. So we manage things better, but people are living longer with severe health problems. Couldn't update this because the webpage wouldn't allow me to, but this is just an overview of what's causing UK deaths. So there will be some changes in it, minor, but it gives you an overview, and you can see the bit in red is the heart and circulatory diseases. So if you go onto this website, normally you can see the details of all of that and what the big causes of deaths are. So I hope that's given you a bit of an overview of why cardiovascular disease is so important and some of the terminology. And it's really important you make sure you understand those different bits of terminology.